Assalamualaikum and hi Miss. Okay, I've checked the condition of your teeth, and before we proceed to the treatment, I would like to share with you the oral hygiene instruction on how to take good care of our teeth and to keep it clean, healthy and last long. Okay, but first I would like to share the basic of our tooth structure. Okay, basically our tooth structure consists of three parts, which is the crown, okay, the neck, and the bottom one is root. And our tooth has three layers, which is the outermost layer is enamel, the second one is dentin, and the innermost part is the pulp. Okay, then our tooth is supported and held by a few tissues, which are our gums, okay, and the thin layer that covers the root, which called as cementum, and it's surrounded by alveolar bone, which is our bone, and there are ligaments that connect our tooth to the bone, which called as periodontal ligament. Okay, so how do we know that we have healthy gums? Okay, there are four characteristics of healthy gums, which the color should be pale pink, okay, or coral pink, okay, and the shape, the interdental papilla should be sharp. Here, okay, interdental papilla is the gums between tooth. Okay, this is the interdental papilla. It is sharp. Okay, and the consistency should be firm. And if you look closer to the gum, there will be a presence of stippling, or it looks like an orange peel appearance. Okay, so this is the important part, which is about plaque. Okay, what is plaque? Plaque is a soft debris that in pale yellowish in color that occurs naturally and attached to our tooth surface, but it contains a lot of bacteria in it. Okay, but if we left it unclean, okay, this plaque, it can become hardened and it can form calculus, okay, which is really hard to remove by our own. Okay, so what it really concerned about plaque is it can initiate into two main diseases, which is tooth decay and gum disease. Okay, so let's see first the tooth decay. Okay, so how tooth decay happen? Okay, tooth decay happen when the tissues, like I said just now, it has three layers, right? Enamel. Okay, the first layer is enamel, second dentin, and the most inner part is pulp. Dissolve of those tissues. Okay, first it dissolve at the first layer, which is enamel, and then it is still reversible. We can treat it, but if we left it untreated for a long time, it will come down deeper to the dentin and then later to the pulp. Okay, and it leads to a more complicated condition. Okay, next is the gum disease. Okay, so gum disease is the disease that affect the tissues around our tooth. Okay, that gums, bones. Okay, and if we this happens when we let the pulp that attach plaque on our tooth surface, and we left it untreated for a long time, it can occur some changes the tissues around the tooth, and this gum disease include gingivitis and periodontitis. Okay, so how we want to detect the severity of the gum disease? Okay, first the clinician will use an instrument, not sharp, okay, it called as probe. It will insert into a pocket, okay, a pocket here, okay, and it measures the depth of the pockets. If the pocket is less than 3.5 millimeters, it will consider the gum is healthy. Okay, but for the patient that has gingivitis, or simply called as inflammation of the gum, the instrument, the depth still less than 3.5 millimeters, but we can see ourselves the appearance of the gums is quite different from the healthy, which is swollen. They will be swollen, red in color, and sometimes it can bleed spontaneously. Okay, but for some patient that has gingivitis, not all but some, it can be progressed into the more severe condition called as periodontitis. Okay, this occur okay, the pockets of the periodontitis patients is more deeper than 3.5. Okay, and as time goes by, the pockets become more deeper and deeper. Okay, and how it's happened, because there will be a bone loss that surround the tooth. The bone will recede, and as well as the gum also will recede, and that's why the opening of the pockets will become more bigger and more deeper. Okay, so this is the patient with gingivitis. Like I said previously, the patient with the healthy gums, the normal for the healthy gums is in pale pink in color, and also the shape should be sharp. But here we can see the patient with gingivitis is the gum is red in color here, and they will be swollen, and the shape of interdental papilla, which is the gum between the teeth, is blunt. It's not sharp in shape, and there will be a bleeding, okay, here of the gum. Okay, this is the condition where the patient progress into severe periodontitis, and the patient with this disease will have a few complications like elongation of tooth, spacing, bad breath, tooth mobility, drifting of the teeth, and there will be bleeding, of course, and gum recession, and ossuperation, or there will be form of pus. Okay, that's all for the oral cavity condition. Now I would like to talk about the brushing, the correct brushing technique. Okay, before go further to the technique, the correct technique, I would like to go to the toothbrush itself. Okay, the selection of toothbrush also is really important in brushing our teeth. Okay, it is advisable that we brush our teeth twice daily, which is really good enough. Okay, morning and night before go to bed. For the bristle should be soft. Okay, so it will not damage our gum. Okay, the handle itself also is really important. It should be comfortable for us to hold. Okay, now we go to the correct brushing technique. Okay, first, okay, this is the correct way how you brush our teeth. Okay, we face the toothbrush to the surface here, and then angulate 45 degrees towards the gum, and go and do a back vibratory action and back and forth motion with a few strokes, maybe 10 strokes, and sweep downward like this. Okay, and same way as to all the surfaces, and also at the inside, same technique too. Okay, 45 degree and sweep downwards. But for the front teeth at the inside, do the vertical motion. Okay, the same way as the lower part. Okay, lower part, angulate 45 degree. Okay, like this, and then do the back and forth motion, and then sweep upward to the occlusal surface. Okay, and do the same way as the other surfaces. And also don't forget the occlusal surface, like this. Do like back and forth motion like this, and also to the other side of the tooth. Okay, and then next is the single tufted toothbrush. Okay, this is a toothbrush where we use to the area where it's hard to reach by this toothbrush. Okay, so the hard area is at the back area, the most back area of the mouth here. Okay, so the techniques just like the normal toothbrushing technique. Okay, so face the toothbrush towards the surface, and then do the motion like this. Okay, don't forget to do the inside part too. Okay, just the same technique. Okay, like this. Okay, also just the same as the lower part of the mouth, like this. Okay, next is the correct technique how we floss our teeth. Okay, it's advisable to use the floss once daily. Okay, take about like 45 centimeters like this. Okay, for the upper teeth, we use index fingers. Okay, wind it up, wind it around our index fingers. Then use the thumb to control our movement. Okay, so how we floss is we insert between the teeth and do the up and down motion, just like that, until we hear the sound of squeaks. Means that it is already clean. Also the same way as the lower part, but lower part we use middle finger, both of our middle fingers. Okay, so wind it up, this, and use our thumb to control the movement. Okay, and then do the same way just like the upper one. Okay, do the insert between the teeth and do the up and down motion. Make sure do it to all between the teeth. Okay, so that's all from me on the oral hygiene instructions. So thank you.